Child-Parent Psychotherapy is a psychodynamic, long-term clinical intervention for children and their caregivers who have experienced some type of trauma. And that trauma could have been a single one-time event, or it could be chronic, ongoing abuse and neglect. So we think about how we, and it's in a psychodynamic intervention style where we have lots of assessment early on, where we're looking at the caregiving history, the child's history, both the caregiver's behavior and symptoms, as well as a child, and their interaction together. From that, we help develop what we call a narrative to help that we introduce to the child in our core intervention part of our treatment, where we give them words for what they've experienced, and we help them speak the unspeakable with the parents. It is psychodynamic in nature, so we are following the client. The client hears the relationship between the parent and the child. So we're not just focused on the parent, and we're not just focused on the child. We're focusing on how they work together and how they make meaning together. We're thinking about attachment, we're thinking about security between the parent and the child, and how do we help them grow and promote security with that. Part of that is psychoeducational for the parent too, and understanding. So there may be times that's psychoeducational for parent. There may be times that we're really focused in play therapy together. There's a lot of play involved. There may be times that it's just emotional support for the parent and helping them connect to resources, or even case management, because we know when families aren't doing well, it's hard to then get to focus on my child's emotional well-being when I'm struggling financially, or struggling, because I'm homeless, or, there's one big piece I think that sometimes can catch parents off guard, and that this is just as much about you as it is about your child. And that sometimes, depending on the relationship that they have with the clinician or the agency, can feel very threatening. So that openness to be able to know that when I'm entering and asking for help for my child, I'm also asking for myself. Moving into the treatment end is like, okay, there is something that's happened or is happening, and it absolutely is derailing development. And or for example, we know a kid has had a very traumatic experience. We're not gonna just wait and see what happens. Let's go ahead and get in there and do something to provide support to the family, so that, because we know the earlier we intervene with children, the better off. So it can take place in multiple areas. And so if you have for example, Project Family here in Athens is center-based, and there's options for families to go to a center, to a playroom, to meet with a clinician, and there's also home visiting based as well. So if a family, most of the work that I do is home visiting based with families, because it's important to see them in the home and to see the environment. Child-Parent Psychotherapy is a long-term therapy. It is not, we are on the child's time there, and that moves very differently. And it could be just to get through the assessment phase, some of the core intervention, and then termination. You're looking at a minimum of 4 months, 4 to 6 months, and then sometimes we will see kids for 2-3 years, depending on what's happening. And it's, for example, for a child that has experienced trauma, you may move from one thing to the next in your treatment plan. So you may have one area kind of resolved, and then you might have something else that you kind of help support with the family. So that it can be quite long-term. You would see a family weekly. Now, if it's a case where the family is in crisis and needs more support, certainly you could see them 2 times a week. And then as a family gets more stable and they're able to practice some things on their own, you might see them once every 2 weeks. A big piece about child-parent psychotherapy is speaking the unspeakable. It's helping families find words that are appropriate for kids, that are developmentally able to understand, to give language to what's happened, so that it doesn't stay in this kind of unprocessed sensory place in the body that doesn't have words organized around it. So our base brain, our stress response system, we're trying to give words to it to help create meaning, to create coherence about what's happened or is happening for the child. And those can be hard conversations. Sometimes parents and we as adults aren't comfortable with what a child's experienced or gone through. And so these kinds of books, even though written for kids, also help us to do that.